In today's tutorial, we will demonstrate the DeRoyal T600 cold temperature therapy unit. This unit can be used to temporarily reduce pain and edema post-injury or post-surgery of the knee, back, and or the shoulder. As stated by the user guide, which is provided with every unit, this unit is intended to be used by prescription only. This automatic temperature-controlled unit serves to provide patients with hours of cryotherapy. It is portable, lightweight, low-profile design system that is well suited for treatment in any medical setting and home setting as well. Specifications of this unit include a digital temperature readout. It also measures, adjusts, and regulates motor speed for precision temperature without manual adjustment. And it also has an automatic shut-off feature to let the user know when to add more ice. With this unit, cold temperature therapy ranges from 45 to 60 degrees Fahrenheit. If interested in purchasing this unit, which uses a 12 voltage DC current or 1.5 amps, please contact the manufacturer DeRoyal by phone at 1-800-251-9864 or via mail at 300 Deeb Lane in Tennessee. And if additional information is needed, please visit their website at DeRoyal.com. The current cost of this FDA-approved unit is $188.99. For further questions or further troubleshooting, please consult the user guide.
To further support continuous flow cold therapy, a study conducted by Marissa found that continuous flow cold therapy is advantageous for post-op care with no adverse effects on wound healing. In this study, they took 30 patients who underwent bilateral total knee arthroplasties and applied a continuous flow device on one leg of the patient. As a control, no continuous flow cooling device was placed on the other TK in the same patient. Data was collected over 6 weeks. In conclusion, Marissa found that the application of a continuous flow device 6 weeks post-TKA resulted in a lower volume of hemovac output and blood loss, lower visual analog pain scales, and less analgesic consumption. In another study conducted by Barber et al., it concluded that continuous flow cold therapy is an effective tool for post-operative ACL reconstruction patients as well, specifically as it decreases the use of Vicodin use. Lastly, in a study conducted by Barber that compared crushed ice and continuous flow cold therapy in patellar tendon graft ACL reconstructions, they found statistically significant decreases in pain medication use, and increases in range of motion 1 week post-surgery when compared to the patients who received just crushed ice as a modality. And now we're going to go ahead and present a tutorial on how you would use this with a patient.
So after the surgeon has applied stitches, they will cover the wound with gauze and then apply the device and add a brace on top to hold it in place. And this is how the patient will present when they come to see you. Before applying this device to a patient, we need to clear some contraindications. It can cause cold-induced injuries if not properly prescribed. Therefore, make sure to clear the contraindications and precautions prior to use. Contraindications include history of cold injury, frostbite, or adverse reactions to cold therapy, incoherence due to sedation, anesthesia, coma, or sleep, decreased skin sensitivity or localized circulation or wound healing problems, including those caused by multiple surgical procedures, circulatory syndromes due to Raynaud's disease, Buerger's disease, peripheral vascular disease, vasospastic disorders, or hypocoagulable clotting disorders, hand, wrist, or foot, ankle surgery exhibiting polyneuropathies, hypersensitivity to cold, children 12 and under, local tissue infection, or diabetes. General precautions with use of this unit include awareness that it's normal for condensation and couplings to occur on the therapy blanket when in use, depending on the air temperature. However, do not continue use if skin barrier becomes moist. Change to dry barrier as necessary. Avoiding pouring water directly over the power receptacle located on the back of the unit. Unplugging the unit when not in use, and proper use of the country electrical adapter.
I'm
me walk you through how to set up this device. The AC adapter has been plugged into the wall to the power, but we're not going to plug this in yet. First, I'm going to connect these tubes to the cryotherapy blanket extension. Once you hear a click, that means they have been connected. Then we'll open this box, fill it with ice, and top it off with some water. Once it's filled with ice, you recap it. And then plug this part in, making sure not to get water on any of the electric parts. Once the device is ready to use, it will show a green light. If it shows a red light, that means you need to add more ice. What's happening now is the cold water from this device is going through the tubing and into the cryotherapy blanket to cool the skin and the tissue. To stop this device, all you need to do is unplug it, either from here or from the outlet. So I'm going to go ahead and plug it. The device is off. And to disconnect, you click these silver buttons and you're done. This part stays attached to the patient.